Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
CNS monitoring. CNS monitoring is in the CNS or central nervous system monitoring. We have to monitor two parameters. One, depth of anesthesia. Second, neurological assessment. So we will have to learn both of them in detail. Depth of anesthesia. Depth in central nervous system monitoring, depth of anesthesia is monitored. So depth of anesthesia, the clinical signs of light anesthesia include hypertension, tachycardia, sweating, lacrimation, bronchospasm, laryngospasm and movements. So all these are the clinical signs of light anesthesia. So in order to know the depth of anesthesia, we have two monitors. First is EEG. EEG is electroencephalogram. That is prefrontal electroencephalogram is done. In prefrontal electroencephalogram, beta waves will signify light anesthesia, alpha waves will signify moderate depth, theta and delta waves will signify deeper anesthesia. Second, EEG based monitors, that is electroencephalogram based monitors. One, we have bispectral index monitor. Bispectral index monitor is the best and most commonly used monitor. In bispectral index monitor, the adequate depth of anesthesia should be 40 to 60. If the bispectral index monitor gives the value of 40 to 60, that is the adequate depth of anesthesia. If it gives the value of 0, that means the patient is brain dead. If the bispectral index monitor gives the value of 100, then the patient is awake. Bispectral index monitor. The second EEG based monitor is entropy. Entropy is similar to bispectral index monitor. Third EEG based monitor is patient safety index. Fourth EEG based monitor is narcotent. Then the second type we have non-EEG based monitors. In non-EEG based monitors, the expired concentrations of inhalational expiratory concentrations of inhalational agents are around 0.7 to 1.3 minimum alveolar concentration. So, neurological assessment. CNS monitoring. In the CNS monitoring, we have to see the depth of anesthesia and the neurological assessment. First, in the depth of anesthesia, for light anesthesia, the clinical signs which are seen are hypertension, tachycardia, sweating, lacrimation, bronchospasm and laryngospasm, and movements of the patient are seen during the light anesthesia. The monitors which are used are of two types. One, EEG. Second, EEG based monitors. EEG is prefrontal EEG is most commonly performed. If EEG waves show beta waves, then it means light anesthesia is seen. If EEG waves are alpha waves, then it is moderate anesthesia is seen. If EEG waves are delta and theta waves, then deep anesthesia is seen. Then we have EEG based monitors. In the EEG based monitors, we have bispectral index monitors, which is the best and most commonly used. These bispectral index monitors, the value is 40 to 60, then it is adequate. 0 signifies brain death and 100 signifies that the patient is awake. Entropy is also calculated. Entropy is almost similar to bispectral index. Patient safety index and narcotent is also the EEG based monitors. We have non-EEG based monitors. These non-EEG based monitors, here we calculate the expired concentration of inhalational agent. It should be around 0.7 to 1.3 minimum alveolar concentration.
thank you and thank you for watching.